goal of this presentation is to explain the operator-dependent variables of the 3x4 scanning quality checklist that should be used in daily musculoskeletal ultrasound clinical practice. Using this checklist will ensure that you scan your patients in a critical and qualitative way and that you lower the risk of false positives and false negatives. Musculoskeletal ultrasound is heavily operator and experience dependent. To ensure scanning quality and to make scanning a little bit easier, we have developed this 3x4 scanning quality checklist. The checklist consists out of 3 major points to think of during scanning: the operator or yourself, the ultrasound system, and the transducer. Each of the 3 points have 4 sub-points that you will have to think about. By using this 3x4 scanning quality checklist, you won't forget the most important variables to create a proper ultrasound image. Let me first focus on the operator-dependent variables during musculoskeletal ultrasound scanning. The operator or sonographer's position, the ergonomics, will affect image quality. A poor position will lead to unsteady transducer handling, not being able to reach the control buttons on the ultrasound system, and not being capable to scan for a longer period, which results in hasty work. All of this leads to poor image quality. This is an example of an inappropriate way of scanning. The sonographer has to reach for the patient as well as the machine. This creates an inefficient examination with undue muscle strain and fatigue. The area being examined is not in line with the screen. Attention to body position for both the sonographer and the patient can improve the efficiency of the evaluation and minimize strain or overuse. The patient should be placed in a position that provides easy access with the transducer and allows a comfortable arm position. Having to reach excessively can lead to fatigue, overuse injuries, and poor image quality. The patient should generally be placed between the examiner and the screen, allowing visualization of both. The machine should also be close enough to allow easy access to the controls without excessive moving. Attention to these details can make the scanning experience much easier for both the sonographer and the patient. When starting to scan, one of the first things to do is to apply ultrasound gel to the transducer. Without gel, the image will be of poor quality due to air interference situated between the transducer and the skin. Air is a very bad conductor for the ultrasound beam. Applying gel between the transducer and skin avoids and limits the interference of air. This image has been created without the use of gel. See how dark the image looks and how few details can be seen. This image shows much more detail and brightness due to the application of gel on the transducer. Always make sure that there is plenty of gel present. It not only serves to prevent the interference of air, but also enhances the gliding possibilities of the transducer when sweeping the transducer around the region of interest. As soon as the gel dries up, please add additional gel again. If you would like to scan a certain anatomical structure or tissue, make sure that you're scanning this actual structure or tissue. This might sound obvious, but trust me, this is harder than you might think. Many structures or tissues in the human body look alike, especially when the observer, the sonographer, is not experienced. The goal of this image is visualization of the transverse flexor pollicis longus tendon and it has actually been scanned. The hyperachoic tendon is pointed out by a yellow arrow. When new in the field of musculoskeletal ultrasound, the most important thing is to build up experience by scanning many people. Experience in scanning a particular structure or tissue results in seeing this particular structure or tissue in many variations. This experience translates into a fictive ultrasound library in your head. This ultrasound library contains many images. Experience in scanning teaches you how a structure or tissue should look like and where to find it. When searching a specific structure or tissue, please use your own ultrasound library for comparison. When scanning, you would like to have a good overview of the whole region. You don't only wish to see the region of interest, but also the structures and tissues surrounding it. It's important for your diagnostic or evaluative process and your clinical reasoning to see the overview, the functional relation, and to see the quality of all structures and tissue visualized. Therefore, the region of interest should be centered. Centering the region of interest on the screen and maintaining that position during live scanning is a transducer skill that should be practiced when first starting to scan. It's also needed to prevent the desired image from repeatedly drifting out of view when scanning more rapidly. This image shows a transverse flexor pollicis longus tendon on the right side of the screen. Everything to the right of this transverse flexor pollicis longus tendon has been cut off. The only structures and tissues that can be assessed are the transverse flexor pollicis longus tendon itself and everything on the left side of the tendon. Hence, this image provides only half of the information that is needed. The same situation goes for this transverse flexor pollicis longus tendon, which has been visualized on the left side of the screen. Everything to the left of this transverse flexor pollicis longus tendon can't be assessed. The appropriate way to visualize this transverse flexor pollicis longus tendon is to place it exactly in the middle of the screen. Now we have a nice overview of the entire situation. We can assess the region of interest, but also the structures and tissues surrounding it. We can see the overview, the functional relation, and the quality of all structures and tissues visualized. Thank you for watching.